Should I have surgery for a disc herniation? That's a great question. If you Google things, they'll probably say, well, if you don't respond to care within 6 weeks of what we call conservative therapy, then maybe you might need a surgery. Well, I'd like to add upon that and say that yes, usually 6 weeks of non-eventful care is kind of startling, but it's not uncommon, sadly. There's a lot of types of care out there which is not specific to a disc herniation that people think that they're doing, or they feel like they have given it a fair chance, but they really haven't. Typically what happens when you are recovering from a disc herniation is that you need to do a bit of homework. And this homework should be specific to usually not rounding the spine or building some supports around this area, not just the front core, but the side core, the back core, the top, the bottom, and also the hips. These are foundations for recovering from a disc herniation. Now, should you have surgery with a disc herniation? Now, it all depends upon your symptoms. Well, we have something we call the big three, or the red flags. Usually these things are more urgency for having a surgery on a disc than others. And so the three things are, number one is bowel and bladder changes. Have you felt like you've had changes in frequency or some other type of variable with bowel and bladder that you have not before, such as urgency or how many times you have to go throughout the day, or you can't control them? That's one. Second is foot drop, meaning you walk down the hall, you're starting to trip on rugs and you can't keep your foot up. It feels like it's weak. That's number two. Number three is numbness in the shape of a saddle, which we call saddle anesthesia, and you can look up all three of these when it comes to red flags of lower back pain. Now, pain itself is not an indicator of surgery, which it might startle a lot of people when I say that. Even if you're at 10 out of 10 pain, it is not necessarily an indicator that you need surgery. It's the three things I mentioned before. So if you are suffering with a disc herniation and feel like you've tried everything under the sun, you probably haven't. You haven't tried us. We do a very good job with disc herniations. Please read all of our reviews on Google and Yelp. We've done a really good job with many people who have been very gracious enough to leave reviews. So I'm thankful for that they've done that. So I'm Sebastian at Performance Place in Huntington Beach, California. We'd love to help you through it. Even if you come a couple times, I think we can do a really good job with helping you out in the right direction. Reach out. Love to see you soon.